You hear the trite phrase all the time, hardware is hard. Well, now you combine hardware with the deep tech challenges we've had to solve to safely and autonomously interact with human bodies, and you end up with something that's remarkably complex. So I guess it was just my boundless, naive optimism that ultimately empowered this.
Welcome back to the Fitt Insider Podcast. I'm your host, Joe Vanair. Today I'm joined by Eric Litman, founder and CEO of Aescape. In this episode, we discuss the company's robotic massage experience. Eric details Escape's 7-year journey to launch. Plus, we talk about partnering with Equinox, creating an on-demand massage marketplace, and the future of human-robot interactions. Let's get into it. Today's episode is brought to you by EGYM. EGYM provides fitness and health facilities with smart workout solutions built on its ecosystem of hardware, software, and partners. But it's more than cool tech. Their connected training experience delivers business results while helping members reach their wellness goals. If you run a gym, health club, YMCA, or any kind of fitness facility, you should check them out. Visit egym.com to learn more. Hi, Eric. Welcome to Fitt Insider. Thanks for joining us.
Great to be here. Thanks, Joe.
Yeah, excited to chat. I think maybe right off the top, why AI robotics? Why massage? How did these two things come together to create Aescape?
Yeah, God, I think I have a couple of answers to that. I think number one, I am clearly a masochist to have picked a project this hard, but I'm also trying to solve a very personal pain point. I started this 7 years ago because I had a bulging disc in my neck and I had no idea that was the problem. And I spent 8 months of my life getting a massage just about every day in just about every country you can imagine, where all I needed was just an elbow in this spot right here, just to be able to do this, just to move, just to be able to sleep at night, just to be able to exist. And most of the places that I went to were well intentioned and they would try, but you'd kind of forget the mission and they'd either go off on their own path because they thought they could do something better, or they would just go into rote execution. Like, I'm just going to do the treatment that I'm used to doing and hopefully it'll get some therapeutic value from that. And most of the time it just didn't help. So I set out on a path to go build something that I wanted for me to fix me and hopefully lots of other people that want just that very specific thing.
Yeah, you mentioned kind of 7 years in the making, and you're a pretty prolific entrepreneur and operator yourself, and making this jump into robotics, essentially. Obviously, you have the hardware and software components. When you initially even say, hey, I have this problem, and I think a lot of people who may be athletes or have sought out massage for therapeutic benefits say, yeah, absolutely, this is definitely a problem. We can't really find people, or they don't quite get to the spot that we needed to, and certainly not consistently enough. But saying maybe a robot can do this, and like actually executing against that, where does one even begin to make that leap towards like, yeah, we can bring this to life?
In other parts of my career, I've known people who've done crazy things, who've built really hard projects. And while I've never done anything even remotely this complex in my life, I have those people on my network. So as I first started to think about this, my instinct initially was just go research what can be done in robotics today. And I spent a couple of months with a bunch of napkins drawing out what I thought could have been a product that could eventually solve what we're doing today. And much of it looks like what it is, what we're doing today. Some things I got wrong. But then through that discovery process, I talked to other hardware entrepreneurs and I talked to people in robotics. And I got a lot of opinions, most of which were telling me not to bother going doing this because it was just a really hard problem. Probably not achievable given today's technology. This is back in 2017, and definitely not worth the effort that it would take because most people that have built hardware products have just taken a lot of battle scars along the way. There seem to be these antibodies in the universe that don't want complex products to come to fruition. And anything and everything can go wrong. You hear the trite phrase all the time, hardware is hard. Well, now you combine hardware with the deep tech challenges we've had to solve to safely and autonomously interact with human bodies, and you end up with something that's remarkably complex. So I guess it was just my boundless, naive optimism that ultimately empowered this. If I'd listened to the really smart people telling me not to do this, I probably wouldn't have done it.
Yeah, sometimes that's what it takes, right? Not knowing any better and being naive to just how challenging it will be. Yeah, during that time, you mentioned again 7 years, like talking to people, having those exploratory conversations, getting to work building. What was it that kind of took that long in development? Was there one particular problem? I'm sure there's more than one, but when you think about, how long it takes to bring it to market, what kind of challenges come to mind? Was it like a limit in technology? What was even possible, or putting the pieces together, or how you even went, stayed with it for that kind of amount of time before getting it to market?
Yeah, I think you have to point to a given spot on the timeline to identify what was particularly hard. In the earliest days, it was a combination of things. So, number one, just being able to figure out how to move a robot in a way that felt really familiar, right? Our product is very distinct from a massage therapist, and it's intentionally not trying to recreate a therapist. But in order for people to love what we're doing, there has to be a sense of comfort that inherently comes with engaging with it. And robots, well, they're robots. When people think of robots, they think of either silly moves on the dance floor at a wedding or things that lift cars up and move them around on assembly lines. They don't tend to think of something that can be very personal and engaging directly with their bodies. So figuring that out was particularly hard. 2017 wasn't a particularly attractive time for investors to put money into hard, deep tech products. And when you're blazing new ground in an entirely untrodden space, like having robots come in contact with bodies, there are very few people that want to put money into that. So early days fundraising was challenging. I'd like to say it was about as much fun as unmedicated invasive dental surgery. But we got through some early proof points, and then the next challenges came along. Okay, well, how do we now model the human body in a way that makes a representative sample of all of the sorts of morphologies and people that we're going to see over the course of our engagement in the market? That was hard. And then we moved on to the engineering challenges, right? So scientific, financial, now engineering challenges. And then as we went along, then supply chain challenges and no global pandemic. And you just kind of pick all of these things. But I was given a really important data point and frankly a lesson that's helped to guide me through a lot of this by another robotics founder, a very successful one early on. And he said, Eric, the universe of people who will invest and just generally buy in to a very complicated deep tech product that looks like a science project is much smaller than the universe of those same people who will buy into something that doesn't require them to have a whole lot of imagination to see its future. Big lesson being, make it pretty, make it demonstrable, make it consumable from day one. And that ethos still exists with us today. We built something that I think personally, I'm incredibly biased, but I think it's really pretty and I think it's really engaging. And it's capable of showing not just where we are today, but this is the beginning of a much larger vision for how we can continue to come in contact with humans and build a whole new model of human robot interaction.
I definitely getting to that long-term vision. I want to get the conversation there, but quickly just thinking about even that idea of interacting with the human, humans now, right? The user of the product when they come in to get a massage, describing the experience, right? Maybe for someone who's not familiar, I would encourage them to, well, go check it out if there's one in their city, or go at least watch a video online, because it is pretty incredible just what the entire bed, the robotic arms, the screen, the scan looks like. I'm sure you do a better job of describing it to me. So what is that experience like, and how have you kind of built on that experience to say this is something that people can be comfortable and feel safe and really enjoy it, and get the benefit out of it?
Yeah, and that really underscores the most important point. People have to be comfortable. People have to feel like we're doing something that's distinctly for them, and that's been quite the challenge. But the experience, despite all the complexity of what we've had to build, it's very simple. It's very straightforward. So you book through an app that feels like a booking app you've used before. It feels like a Resi or an Uber type experience where you open it up and you see all the tables that are in the area around you. You have the ability to go book on any one of them if they're available to the public. You can go get a massage right now if that's something you want to do. We've introduced this whole concept of an on demand massage, which doesn't really exist in the world today. When you go into the facility, you're greeted by somebody who's familiar with the product. And this could be, we've announced Equinox as a partner. We're going to be announcing a number of other partners here shortly, but by somebody who's familiar, knowledgeable, helps allay any questions or concerns you might have. They hand you clothing. These are really nicely designed athleisure type clothing that provide technical benefits for the product. You don't have to get oil or lubricant on your body. It keeps you sort of secure and nicely packed for the system to engage with you and manages friction. You then lay on the table, sensors overhead create a 3D model of your body, which then defines and personalizes the experience so that when we're engaging with you, it's really about your body and not something generic that we're doing to anybody. There's a big touchscreen in front of you right beneath the headrest. It shows off your body in 3D, lets you make changes to the massage in real time. Say, I want more here, I want more pressure. I don't like that music. I want to listen to piano. I want to listen to Metallica right now because that's going to get me energized for my massage. And then as you complete the treatment, it then remembers you so that between each of your visits, there's consistency, there's an opportunity for ongoing personalization and development of that relationship, that through line that you would build with a practitioner, but now it's technologically enabled. And whether you're at an Equinox here in New York or a partner in Los Angeles or in Singapore or Hong Kong, there's something that's always going to treat you in the way that you've already told it to treat you. And over time, it will collectively learn from you and all of the treatments it gives across all of the tables and just get better.
Yeah, I think that point is especially interesting. Building this kind of knowledge of you, applying it, making sure that it's, addressing the kind of it's difficult for anyone who's had a massage to, while you're getting massage, actually like communicate and tell somebody, no, actually over here, or maybe a little bit harder or softer, but being able to control that with a touch screen, I think is especially kind of interesting and certainly an advancement on the experience. There's also this kind of, when people think of like maybe automated massage, like a massage chair, right? You go and you kind of sit down and it has the rollers and it vibrates, or maybe even taking like a massage gun and maybe doing it yourself. But this is actually arms that replicate a human, is I guess as close as you can when you think about both what it looks like, how they feel. How did you arrive at that kind of form factor, and also the ability to say like, we know what is too much pressure or what is not enough pressure, and where there's the ability to really ratchet that up, like, oh no, this is like the safe zone, or this is what's effective, and how you even arrived at that like sensation.
Yeah, the arms were a natural choice. They're the arms that we're using. They have 7 different degrees of freedom, like the human arm. We can we can articulate them in a way that's just going to feel familiar to the end user on the table, so that there wasn't any real question from the very, very earliest days that arms are the right choice. But interestingly, we've had to spend quite a bit of time thinking about not just how to make this feel familiar, but how we can leverage technology to build something that's different and distinct. So you go to an important point of safety. Let's pick that one apart, and then we can talk about some of the other distinctions. When you or I are giving a massage to a loved one, we don't definitively know how much force or how much pressure we're applying. We have no sense of the elasticity of the tissue that we're working on, and the strength of a particular bone, and whether we're pushing too hard or not. We can intuit it. We can assume that we're not going to hurt someone, but we don't specifically know. It turns out we as people are really terrible at absolute measures, right? Could you tell me just how much space this is specifically? No, we know it's generally this big because we're seeing that it's this big, but quantifying it down to the number of millimeters is a really hard problem, similar with applying force. In a technological system, you don't have that constraint. In fact, it's quite the opposite. We measure very discreetly and very specifically exactly where we're applying force in the body, how much force we're applying, how much pressure is being applied. And we've worked with very smart people to help us to position that appropriately, both we're the roboticists on our team, but notably medical professionals to help us define how much force and how much pressure can be applied to various parts of the body. And we ensure that we just don't ever exceed those limits. Notably, the arms that we've built, they're really good for giving a great massage. They're not any stronger than that. They're just mechanically strong enough to give a good massage. The gearing, the motors are incapable of generating a very large amount of force that a human could easily generate and do damage to your body. So that's an important distinction there. But also, and I'll go back to something I said earlier, we're really not trying to replicate a therapist. There are so many great things a really good therapist can do with you and for you and together on your journey that we're not even going to attempt to do, because in many cases, the human connection really is required. The level of empathy, the sorts of peripheral work that they can do, the guidance that can be provided. but we can do a number of things that therapists don't. So, for example, we have two arms on the system, and those two arms are capable of applying equal force to both sides of the body simultaneously. It's not really something human bodies are capable of doing, which means that in most circumstances, we can do double the amount of work in an equivalent amount of time. So for us, a 30-minute treatment, we like to think is at least of the therapeutic value you would get with a therapist in an hour, potentially even more because we're pushing just as hard in both directions, going up and going on the return stroke, because we're not lifting off the body to relubricate. We're not stopping to move around the body. Those are just small examples. We also heat what comes in contact with the body. We call them air points. That's it's a heat level above that of human hands. It's somewhere in between a hand and a hot stone, and it feels really great. And we're very specifically going after the targeted parts of the body that we know and understand from a complex model of the body.
The Fit Insider Podcast is brought to you by our friends at EGYM. This is an exciting partnership for us, and not just because EGYM makes some of the most innovative fitness products out there, but because the entire EGYM team, led by their CEO Philip, is committed to making health, fitness, and well-being more accessible for everyone. And that's a mission we can get behind. By combining their smart equipment with integrated software and hundreds of connected partner brands, EGYM helps fitness facilities stand out by delivering a personalized, gamified workout experience that improves outcomes and member engagement. So if you're a gym or health club operator thinking about how to best serve your members while driving business results, go see what EGYM is up to at egym.com. When you just to that point around safety, and I think hearing you walk through it, like technologically, it's really not even capable of going out of, call it that, like safe zone. But I'm sure that's still in people's minds. Obviously, interacting with a robot, new technology. How much of a hurdle has that safety element been with people who are just starting it, trying for the first time? And how are you able to overcome that?
The technology has been significant. We have a strong engineering team, we have a strong regulatory team, a strong compliance and quality team that have all worked on this problem. But the other half of it, which is I think where you're going with it, is how do we get people over the hurdle? How do we get people comfortable with it? And we have a research team of four here who all day long bring people in to understand what are the reactions to this. This is new technology, right? This is most people have never been in a room with a robot, let alone had a robot touch their body. There's a lot to work through there. So we think a lot about demystifying the technology, but at the same time, kind of downplaying it a bit. There's more than enough technology here. If you're a geek, you can totally geek out. And we're happy to tell you about the details and get you excited about it. But really, what we do is we talk about how you feel. And the research team here, in some very early work we did, that's then very much supported by what we've seen in the lab, they found a pool of 10 million Americans who've never gotten a massage and wouldn't get a massage from a therapist because they're just uncomfortable being in contact, that close of a contact with another person. Either they have body dysmorphia, they just generally don't like people, plenty of those out there. They've had a bad experience, or who knows? There are any number of reasons that might back that up, but they've said they would love to be massaged by a technological solution. And we see that here frequently. We've had thousands of people through the office here with a significant percentage. The organization here pets it somewhere close to 30% who have never had a massage, just wouldn't go for one. It never even occurred to them. And they walk out of this thinking, wow, I would do this all the time. This feels great.
Really, just even improving that interaction, making it feel safe is, again, maybe part of that long term vision when you talk about humans interacting with robots. But one more thing before we get there is even developing the technology, hardware, software, now doing it, getting out in the market. Another thing is the business model, how you landed on basically putting these, getting them licensed, having people operate the tables and robotics themselves. Like, how did you land on this business model? How has the rollout worked? And you mentioned some more partners coming online. How are you even selling those through to those partners in the kind of earlier stages?
But I'm really excited about where we are in the world of robotics today as an industry. I think we're seeing an explosion in capability, in new hardware, new sensors, new software, new learning models. But it's all still expensive. The technology behind this still has some real costs behind. So we needed a business model that would empower us to deliver to our partners in a way that was easily consumable by them, but still capable of sustaining a business that's taken a whole bunch of capital to put together and build.
So, when meeting with potential partners in industry over the last few years, the number one message we've heard again and again is it's incredibly hard to identify, recruit, and retain really good massage therapists. There aren't that many out there, and the really good ones find themselves overworked and stressed. Um, so we looked at what was the cost to run an equivalent number of hours of a therapist that our system run in a given day, and we priced more or less at parity with that. It's a hardware as a service model. We license the table for it's anywhere between $230 and $270 a day, some parameters around that. What we found is it just seems to fit. In the spa world, many spa directors have the ability to make a purchasing decision if it's below a certain level and it's not considered a capital equipment cost. And we're baking in a lot of what we haven't seen in our industry, which is the commitment to our partners that the thing is just, it's always going to work. So with our service model, we will put a service level agreement in place with each of our partners, and we will commit to being on site within a given period of time if something goes wrong. It's technology, things break. We've done a great job of building something we think is reliable, but it would be foolish to think that something might not ever go wrong. So we'll be there. We'll solve the problem and we'll keep them up and running because this is a revenue bearing product for them. All of that together is the kind of the fundamentals of why this business model.
Yeah. Have you said, I guess, are you willing to say like how much does it cost to manufacture a table?
More than I would like it to be, and it's a number we're going to keep working on in the coming years.
Yeah. Is that the margin relative to what you're licensing them for and getting those costs down? Like how essential is that to this overall kind of vision working? Or is that you want to improve that because you obviously just want to improve the expense overall and make it more lucrative? Like, I guess how essential is it to drive down that cost of the table relative to the success or, the executing new partnerships?
What we've heard from market right now is that the price is consumable in most cases. Most of our partners are not meaningfully pushing back today. I would like to bring the price down for our partners. I'd like to bring the price down. I'd like to bring the cost down on our side to improve gross margins. Neither of those seem to be required right at this moment for us to go and help to see the industry.
Yeah. You mentioned Equinox being one of the first partners. When you look at the kind of landscape, whether it's spas or hospitality or sports teams or other gyms, kind of fitness centers, is there like the ideal, hey, this is where we think we can get the most traction, where we've had the best reception? Or is it kind of pursuing all those at once and seeing where the chips fall?
The best partners for us are partners that are engaged, partners that can deliver a premium experience, partners that are capable of managing a technology product. It doesn't require a whole lot. We've made it so that it's relatively simple to manage, but it's more than dropping a desk in a corner. We're helping to bring demand to these. So I mentioned we built the front end mechanics for this. It's a marketplace model where people can go and find an Escape massage wherever one of the tables may exist. Again, assuming public inventory, things like tables in corporate offices will be locked off from that. Tables in private homes and in private apartment buildings will be locked off. So the ability to drive demand on the partner's behalf is important, but we'll also help with that too. We use the term partner very intentionally, and our sales team is our partnership team, very intentionally labeled because we do see this as a partnership. We think that our success in this and our partner success in this are tied together in our ability to delight members. And so the partners that are most capable of delighting members are the ones that we're most excited about.
Yeah. And just one more question on the kind of rollout and partnerships. Obviously, more to come. Do you have, whether it's the first half of the year 2024, a kind of number of tables partners you aim to have in place, or where people can kind of expect to see them in terms of geographically, cities, just talking about the on demand and kind of marketplace model?
Yeah, we're very thoughtful about where and how we roll this out, making sure that we have all the operational capacity to support our tables and support our partners. So in our first 12 months of shipping, we're going to ship 600 tables, and that'll be distributed throughout the US. We're looking at global markets starting in the early half of next year.
I was going to ask if you have one at home, but maybe there's one at the office you can use pretty much any time. So I don't know, you need one at this point.
Yeah, I think the biggest perk of working here is that people just get to get massages all the time.
Yeah, it'll be interesting to watch and see this roll out. Certainly, it's compelling for me. Someone both just general kind of maintenance. I like to get massages and work with a physical therapist and chiropractor, all those sorts of things. But it is kind of always a problem, right? Trying to find someone and book a time and get there, or even if they come to the house. So this idea of having it automated, but when you apply that more broadly just to all other areas of life, how are you thinking about this? Obviously, it's like, yes, this is a focal point. We have to make sure that the massage and the tables and the partners in the business, everything is fully functional, operational, and you continue to scale that. But bigger vision, kind of down the like, how do you see this continuing to evolve when you think about humans interacting with robots?
The challenge we're going after right now really is delivering a really great massage experience. And the message that we like to use internally here is, as good as the product is today, it's the worst it will ever be. It's only going to get better. There's so much more for us to do. We're really excited about continuing to build out personalization capabilities and really allowing you to dial this in to be very much the treatment of your own, and building an ecosystem of services around this, both together and with partners, to support people in their whole fitness and wellness journey. Beyond that, we think the core challenge that we've solved here really is this very, very hard problem of being able to safely autonomously interact with humans through robots. And we have a big roadmap of really exciting stuff that we're planning out on those lines.
Nothing, anything you're able to tease or allude to beyond that? Do you anticipate the interactions and Escape being primarily in the even wellness space, or is it even beyond that?
I think we've just announced to the world after 7 years of being in stealth that we're a massage technology company. Let's do that really well, and then we'll talk about what the next things are after that.
I appreciate it. We'll keep an eye on how that evolves. A couple more questions before we get you out of here. Early on, you mentioned, raising funding and especially doing that for such a difficult problem and getting buy-in for investors. For at this point, I think I've seen as much as 80 million that the company has raised. Do you anticipate raising additional funding, especially now that it's in market, maybe getting some validation, whether you need to, or it's just a nice that you can then accelerate the business now?
Yeah. So the answer is we certainly will be. We have great capital partners behind us who've been incredibly supportive, and we have a ton of interest inbound from the market, in addition to folks that we've been engaging with over the past few years. We're going to be kicking off the Series B raise here shortly, really to focus on growth, on continuing to build out the operations of the organization, and kickstarting the next generation of the big vision for the business.
Yeah, then we look at now, even the back half of the year, we mentioned as much as 600 tables getting out there, adding partners, being in market after 7 years. Is there anything we should look forward to in the near time or that you're especially excited about?
Yeah, I'm incredibly excited about our launch, about people being able to go get an Escape massage wherever they might be. Right now, you can get a massage in Union Square at our partner Press Modern Massage. That's up available. There's a wait list. We're clearing people off the wait list even as it grows. In early summer, we're going to have tables available at a host of partners, starting here in New York City, but very quickly moving into other cities around the market and around the country. And after having done this for 7 years, the only thing we all really want to do is just go give a lot of people a lot of massages.
Absolutely. And website, social, the app, where would you point people in terms of learning more and maybe having that experience?
Yeah. So go to our website, www.aescape.com. It's AESCAPE.com. You can download our mobile app. There's a waiting list on the website. There's a lot of content there, both for partners to understand the economic model and how to engage with us, and for members excited about getting a massage.
Perfect. We'll link everything up in the show notes below. And yeah, encourage people to check it out. And thanks so much for making time to share it with us today.
Joe, really appreciate this. Thanks so much.
One more thing before you head out, help us spread the word. Take a minute to rate and review the podcast, subscribe to the YouTube channel, or share this episode with a friend. And if you like conversations like this, you'll love the Fitt Insider newsletter. We send it every Tuesday. The link is in the description. Thanks again for listening. We'll see you back here next week.